My name is Belva Leer, and I am a cancer thriver. I was diagnosed in 1998 for the first time with stage 2 breast cancer. I had 2 teenagers and a 10-year-old at home. I, of course, being 39, you don't do routine mammograms yet at that point. So I had mentioned it to my doctor. Well, lo and behold, way deep down inside my breast, which I would never have felt, or he would never have felt, there was a lump. And I received surgery and chemotherapy and radiations. And then at the same time, I was working obstetrics and labor delivery. I really felt the need and the pull to jump in and to become an oncology nurse. I just felt I had more to offer. I wanted patients to know I had experienced it. I wanted to show them that there was some life after the diagnosis.
How much longer with the boot?
Another week.
Okay, so you're getting there. Good girl. These steps are kind of a bugger for you.
So then I had 17 blissful years of thinking I was cancer-free, which I was according to all tests. And I had a little wrist surgery we were going to do. So of course my family physician said, you must have a chest x-ray before anesthesia. I had a large pocket of fluid in my left lung. It was metastatic breast cancer cells that were in my lung. I had no shortness of breath. I had no cough. I had no symptoms. I played tennis. I ran. I was active. If not for my wrist surgery, I don't know when we would have found it. Throughout the course of the chemotherapy, you become really weak. I'm really tired. I was always a fairly active person, but the chemotherapy really put me back. What I loved about Sanford was that when I was diagnosed the second time, it is a big team effort. My physician is just the best man in the whole world. He gets me, he understands me, he gives me all the time I ever wanted, and I feel like he cares that I live. And the nurses in oncology, they reinforce things, they help you through the treatments. It's just a huge team effort. And it takes a village to get through all of this. I'm still here, which in 2015 when I was diagnosed, I just thought it was the beginning of the end. And it's just not. At my last chemotherapy treatment, one of the oncology nurses said, have you heard about the Live Strong program? It's an all-around program to help you get your life back. So of course I signed up. My husband gets to come because he's my support person. And we started going to class, and it was the best thing we ever did. I love seeing how people progress from not knowing and being scared to being strong and saying, I can do that. There's a light at the end of this road. You can do it, you can get through it. I know it's tough. It's the toughest thing you'll ever do in your life is to receive cancer treatment. But there is life after.